What's popping? What's popping? So today we're gonna be giving an update on the crisis over the Middle East. We're not so gonna be talking about all the other, bombings and all that that's been taking place, but more so of the underlying public health issues they have are facing over there, especially in Palestine. Now, public health experts have been sounding alarm about this for months, or the month at least. It's been happening because usually during a big humanitarian crisis where a lot of people are moving and fluctuating, as well as there's inconsistent access to like clean water, clean, medicine, all that, you have the chance of disease proliferating and spreading. One of the examples of this is Hurricane Katrina. Basically, when a lot of people were coming from New Orleans, the biggest concerns that people had was that, when people wading through water and sewage, when people were dehydrated, didn't have no clean water and all that, and when you just in general have a huge clot of people bunched up, together, you have a chance of disease running rampant. And that is what we are kind of concerned over going on with Gaza, because as you have about 1 million people being ordered to evacuate, you're going to have that huge clot where disease is going to run rampant. And so dive into this article. Basically, the Gaza Strip faces an increased risk of disease spreading due to Israeli air bombardments that have disrupted the health system, access to clean water, and caused people to crowd in shelters. Now, one of the biggest, things, that is of concern is diarrhea, especially when you talk about the lack of fuel when it comes to electricity. Not only electricity runs your homes, runs your hospitals, run basically a lot of your, cell service and all that, but they run desalination plants. Now, if you don't know what a desalination plant is, it's basically a water treatment plant. And so if you don't have water treatment plants going, you're going to have a lot of access to unclean water, which just raises the risk of bacterial infections like diarrhea, spreading amongst the population. As right now, WHO has said there's about more than 330,500 cases of diarrhea that have been reported since mid-October, the bulk of which among children under 5, since, Palestinians have one of the highest, populations of children in the world. This marks the significant increase compared to an average of 2,000 cases monthly in that age group throughout 21 and 2022. So yeah, this is a big jump in cases. Like, conditions were already bad, but at the end of the day, they've been, worsened throughout this tragedy. And basically the whole lack of electricity has disrupted many, infection prevention measures, not just with cleaning water, treating water and all that, but basically doing basic vaccine routines. The healthcare system is basically collapsed. And so they can't do basic vaccines, kids' yearly vaccines, when you talk about the flu, RSV, the pandemic we're still doing. And this has pretty much, caused a environment where disease is basically spreading rampant. Now, signing off on an NPR article that was released yesterday that basically said the same thing. International aid organizations warn infectious disease outbreaks if humanitarian conditions in Gaza don't improve. They've been saying this for years and years, even before this conflict happened, and no one has really said anything.
Vudo Cal is an American who was visiting Gaza with his family when war broke out. He talked about what it was like to spend 27 days trying to get out.
On many of those days, we did not have drinking water. We would have to go look out for it for hours, not even caring about what we would drink. I mean, ultimately, we would get whatever we would get, food poisoning or etc., if we drank non-drinking water.
Bob Kitchen.
Like, people don't understand like how much of a big issue not having clean water is. Like, people say like, oh, it might not be the worst thing, compared to being, bombed out and stuff. But to imagine how much you need to do with clean water, like on a daily basis, you need it to cook, to bathe, to drink, to do laundry, or else basically you contaminate much of your daily activities. Like, this is a big issue that we're not getting a lot of attention on right now going on in Palestine.
So let's be clear, the primary threat to life right now is tanks and airstrikes.
Yes.
Yeah,
but we're now facing a real threat from the consequences of the conflict. 1.5 million people have been forced to flee their homes, and they're now sheltering in schools and other public buildings. Significant overcrowding combined with a 92% reduction in water, drives real risk of contagious diseases. It's basically a case of when, rather than if, we'll see cholera and other life-threatening diseases. We're hearing about terrible situations from staff working with organizations we support on the ground. In one camp in Khan Yunis, 50,000 people are sheltering together and they only have access to 4 toilets.
Wow.
We'll start
50,000 people to 4
we'll start
toilets.
seeing people fall ill
Yeah.
really soon. And without clinics and medicines, even curable sicknesses represent an imminent threat to life for children and other vulnerable people.
Well, let's talk about the hospital situation. I mean, we've been talking to doctors, people in Gaza who are describing hospitals without anesthesia, hospitals that are no longer functioning, out of fuel, damaged by attacks. And that's just people talking about the thousands and thousands of wounded that they're treating. But if you do get sick, what happens?
You face the risk of loss of life. The situation is really catastrophic.
Like, there's not much that they can do. Like, it's one of those things where there's no functioning hospital. I think the last functioning hospital shut down, I think a week ago. I'm not for sure. But basically, there's no functioning healthcare system. So you got things, even as, we kind of like joke over here in the US that, the flu is very, preventable and all that, but you still got like thousands of people who fall ill and like die from it each year. Like, that is going to be that type of situation over there in Gaza, because you got treatable illnesses that you can actually treat, but people can't get the medicine they need because they're being blockaded, they're being, bombarded, and, they can't get access or humanitarian aid that they need because you got, like, a government that's not trying to let them have it.
More than 100 hospitals have been attacked. We're receiving word this morning of a new attack on the Al Shifa hospital. It's continual. So hospitals are overwhelmed. As you say, they don't have anesthetics, so people are being operated without anesthesia, which is just terrifying. They're discharging people as rapidly as they can because the inflow is so large of people coming in with new trauma. So people who have waterborne diseases are a long way down the list of priorities right now, but that will have a toll on civilian lives as well soon.
Yeah, I mean, we heard from our own correspondent about the reports of that attack on a maternity ward at Al Shifa Hospital. We're still reporting that out. We haven't heard back from the Israeli military either yet. I mean, these humanitarian pauses, are they a way to address any of these issues, getting aid in to where it needs to be, preventing the outbreak of diseases?
It's huge. It's critical right now. We care less about the terminology of pauses or humanitarian ceasefires. What we care about is that we have sufficient duration to deliver humanitarian aid. And with so much damage and humanitarian suffering, that really does take time. We need to change the current trickle of aid to a robust flow of aid. The number of trucks that are able to get in from Egypt to Rafah is tiny compared to the basic essentials for keeping 2 million people alive. So we need a massive scale up of aid. We also, you said earlier about the consequence of fuel. We have to get fuel in if we're going to be able to distribute the aid once it's into Gaza and get the lights back on in hospitals. You can't deliver aid without aid workers, so we need safety for aid workers. We're seeing reports of more than 90 UN workers killed, and many more NGO staff have lost their lives. Only 4 out of the previous 70 NGOs in Gaza are still able to work.
70?
If we can't work, we can't save lives. And
it's a whole tragedy right now. Like, I don't know none of that. Like, out of 70, only 4 of them are able to still function. That is crazy. And so if you're a numbers person, here is kind of like the bubble, like how many people are getting infected. You have about 54,000, about to be 55,000 people having upper respiratory infection, diarrhea, same number I said earlier, chickenpox, 1,000 people, skin rashes, almost 13,000 people, and almost 9,000 people that have scabies and lice. And these are just the main ones being reported. We honestly don't know what is being in there because, they said cholera. Like, if we get, to the point where conditions are very much dire, is definitely like something we can't roll back from if callers start getting into the mix. So yeah, the reason why I'm not reporting on the major, stuff going on over there is because, one, I'm not trying to get demonetized or age restricting again, but two, I want to just note that this is the biggest issues when it comes to public health crises. Like, no tragedy has ever occurred without the side effect of having a, infectious disease outbreak among, not only the people that are fleeing tragedy, but also people that are being taken in, that are taken in, and the aid workers and all that, medical care and staff and all that. This happened during Katrina. This happened during a lot of the major conflicts in the past, few years, especially in the Afghan and Iraq war. You probably haven't heard about it in history, as well as this happened throughout human history, going back to Genghis Khan when he did the rats, experiment with his warfare. And so all this to say that, please keep up the pressure, call for a ceasefire and like to really address the humanitarian aid, because at the end of the day, whoever right around that's, based on how you've been raised. But at the end of the day, it's just we're having like an actual human crisis taking place, and it's just like we need to do more about it, and we need to speak more about it. So with that being said, that has been Pop Health. If you like what you see today, like, subscribe, turn on post notifications. I'll be keeping up to date with the situation over in the Middle East, Palestine, Israel, and all that. You want to see my other content? I just did the Jubilee video a week ago, so go see that. Other than that, stay warm, stay frosty, depending on what part of the country you're in, and peace out.